I'm set for my first surgery of life, LASIK surgery. चलो देखते हैं आज कैसा होता है. Hi guys, today I'm going for my LASIK surgery. Let's go together and see how it is done. बहुत डर लग रहा है, but let's see how it will be done. On my way. So guys, I've reached the laser vision center. यहाँ पर मैं करवाने वाली हूँ अपना LASIK. Let's go for it. Let's see. I'm a little nervous, curious. देखते हैं आगे क्या होता है. Getting rid of this specs. So I've reached to the center. Let's go inside to see what is the process. Come with me. Ready? देखो आप भी.
बंद नहीं करनी है, स्ट्रेट देखना है आपको, सीधा सामने देखना
चल रहा है
सामने, बस आंखें बंद नहीं करनी.
क्लीनिंग आई ड्रॉप्स थोड़ा सा चल रहा है but ठीक है आज और
ऐसा नहीं.
चलने का. तो मुझे LASIK करवाना है.
ओके,
उसके लिए प्रोसेस क्या है?
1 सेकंड मैं आपको डॉक्टर के पास भेजूंगी, वो आपको सब
So I'm waiting for the doctor. I'll meet the doctor and let's see what happens next.
Okay. Rolling.
So meeting the doctor, tell the doctors. So I'm here for the LASIK surgery. Let's see. Doctors can advise देते हैं how's my eye health and what are the precautions and after effects of it and how do I maintain my eyes. So I know कि बहुत लोग सोचते हैं कि कहाँ से करवाओ कहाँ से नहीं करवाओ. So it's been a long research that I've done and finally headed over here, TLVC, the Laser Vision Center. Let's see. Okay, so I'm here with Dr. Siddharth Seran. He's going to guide me for my surgery. Let's have a brief introduction about my eye health. Let's see here.
So Chandrika, you are a myope. So do you wear contact lenses?
I used to, but I stopped during the lockdown because बाहर जाना है नहीं तो कैसे दिखाओ बिना.
So very comfortable with the contact lenses there.
Sometimes, sometimes not. Like dry, itchy eyes, red eyes used to be a problem.
Okay, so when you used to wear them for a very long time,
8 hours to 10 hours minimum, yeah, max 12.
it seems to be fine because we seem to have a lot of drop-offs with contact lenses eventually. So people are happy initially, but they tend to drop off once the contact lens time tends to increase. But the 8-10 hour wear time seems to be good. You should not be wearing your contact lenses for more than 8 to 10 hours. And more importantly, don't sleep in them. Okay. So now one of the first questions which people do ask me is, how safe is the procedure?
Yes.
So
I
when
do
you
have the same question.
that's the thing that people want to compare with contact lenses. So there are many studies. So if you're going to wear contact lenses for around 10 years time, a refractive surgery is safer. Now contact lenses per se are safe. So refractive surgeries are safe provided you take all proper precautions. And the procedure that we prefer to do over here is a transseptal ablation. So now in this, because we're not cutting a flap and we don't have an interface, we tend to get rid of many of the complications. Let's say 95% of on the chart. Okay, fine. That's fine. That's fine. We'll come to that later. We'll come to that later. Okay. So yeah. So if you're going to wear contact lenses for 10 years, yes, this is safe.
Okay.
It's just as safe provided you do not get an infection and you have to be aware of the chances of a regression. Now the chances of the regression are somewhere around 2% when your numbers are more than 6. Your numbers are less than 6, so your chances of regression are
What
way,
is this
way
regression?
lesser.
That means you're going to get back or something?
Yes. Now the first question which most people come and ask me is this permanent? More often not, yes. It is classified as a permanent procedure, but we do have to understand that the eyes change with time. As you probably do know, we do not operate kids less than 18 years of age. So you must be wondering why. Is it less safer in kids? No. We can operate in kids. We do in certain conditions, but usually we prefer not to. So like if a child has -3 at the age of 12 and I do his surgery, I don't. But if I do at the age of 13 instead of minus would be -1. So as long as the numbers are constant, your diffraction is stable. So usually the age between 18 to 40 or 21 to 40 is the island of stability. Your numbers don't change much. Your cornea, as long as the cornea does not change, your numbers should be stable. Okay. So yes, this is classified as a permanent procedure, but some people do tend to get some numbers back. Now, how is it that you can get numbers back? One, if the length of the eyeball keeps on increasing. Can happen in some people, but usually does not. So if I have a patient who has a refractive error more than minus 10 diopters, I do tell them that he might require enhancement in the future. He may require to wear some amount of glasses also. It doesn't happen in everybody, but could happen in some people. Okay, and less than that, yes, there are chances that the shape which we have made could become a little shallow. We can avoid it by taking a few precautions. But if you do get that, okay, so the statistics are it's somewhere around 2%. In our case, it's even lesser than 2%.
Okay,
so 1 in 50 patients over 6 diopters may get some numbers back. Okay, now everybody gets some numbers back. Now this sum is a significant sum. So if it's significant enough so that you can't read up to the last line, that's 6 or 20, whatever you read till, we may need to start you on some medicines, or very rarely we may need to do a laser again. Of course, we don't charge you for it, but that is something you need to be aware of. Okay. The other thing you should be careful about is don't get an infection. The chance of getting an infection is around 1 in 5,000.
Like how do I will get an infection?
Oh, you have to actually make an effort to get an infection.
No, I'm just knowing what are the things I should
one.
avoid.
See, the thing is, the first thing is, just like if a patient gets a surgery done, any surgery, he's not allowed to meet a lot of people. So you have to make sure for the first 2-3 days stay at home.
Okay.
You see anybody with a red eye, just run away from them. You can't afford to get a conjunctivitis for the first 1 or 2 weeks.
Yeah.
Okay, then we have other precautions like no more than the eyes for the first 7 days. Okay, and we do give prophylactic antibiotic and antifungal eye drops or something just in case. So if you do get something, you should take care of that. Right. So that's basically it. So just be careful. Don't put those dirty fingers in your eyes. As long as you don't do that, you should be fine. Okay, so these are the main things which we should be aware of. Okay, if we are doing a flap-based procedures, of course there are some other problems which can happen, those flap-related things. But as we are not doing them, we don't have to be bothered about them. Okay. So having an infection, getting regression are the main things you should be aware of. Get a regression, that's fine. It's the name of the game. We can always address it. Okay. Most of the people will go back to the normal. If it's only an epithelial hyperplasia, we start you on some drops, you go back to normal. If not, if you're the unlucky one, you get one more laser for free. Okay, but you can decrease the chance of getting a regression by wearing dark glasses and being out in the sunlight for the first 3 months. Yeah. So that's basically it. And so for your numbers, do we expect too much of a problem? No, not really. Your topography maps are also reasonably fine. Okay, no, these are not your maps. These are some other patients.
Okay.
So we'll just check up your maps as well.
Okay. I must be. Just a minute. Yeah, so these are the topography maps. Yes. And doctor says that it's fine, so I'm good to go for the surgery. And seriously, I'm not nervous at the time. I'm anxious भी नहीं हूँ, so I'm hoping a good
The surgery per se by itself is painless.
Yeah,
you
that's
could get a little discomfort maybe for the first 72 hours after the surgery, depends on different people. But the surgery per se is not going to be painful. You get a little scared. Okay, so just for that I'm going to let him come in as well and see the whole procedure. Okay. So you can tell us after the procedure whether it was painful, it wasn't. Okay, so let's see. Let's just move ahead. Let's export these
Let's
values.
go ahead. Yeah, sure. With the pre-LASIK preparations. Let's see what it is. Yeah, I'm feeling little like आँखों में कुछ pasty सा feeling है. I think surgery will need it. Feels like कि आँखों में कुछ चला गया. I need to rub my eyes, but as suggested by doctor, you shouldn't ever rub your eyes. Let's see how it goes. More about our retina. कैसा होता है हमारा eye, cornea.
Okay, so there's the eyes, the cornea, the lens, and the retina. We don't want to touch inside the eye. We have to give a new shape to the cornea. Okay, so we will do the surgery over here.
ओके डॉक्टर, सो यूजुअली लोगों को ऐसा प्रॉब्लम होता है कि मैंने सर्जरी करवा ली तो फिर 40 साल बाद भी मुझे करवाना नहीं पड़ेगा?
Oh, great. See, 40 के बाद see, it's not a magic, it's a surgery. Okay, so the basic thing you should know, after 40, this muscles is going to weak, so you will get a number 4 reading. Okay,
yeah.
And there's a lens when they become opaque after 60, 65, they get a cataract. So whatever will be as the age relatively changes, it is going to be there. Okay, and here we are not touching inside the eye. Okay, we are doing surgery over the cornea. Okay, so some precautions you need to know. Initial 3 days you have to take a rest.
Okay.
7 day avoid water inside the eyes.
Complete rest मतलब mobile
Be at
में?
home. Yeah, don't use mobile.
Okay.
Initial 2 to 3 days, no.
Okay.
Okay, initially there will be little watering, there will be little pain. So don't worry because it's recovering. 3 month dark layer when you go to sunlight, that's very, very important. If you don't want any kind of regression, that repeat number. Okay, we worry about the infection, we worry about the regression. We don't. It doesn't happen then. So for this, you have to do one thing: 3 days rest, avoid water for 7 days. 3 month dark layer when you go to sunlight, and eye drop as required you have to put.
Okay. Okay.
Okay, so.
So your eye drops minimum 3 महीने कितने महीने?
See,
Continue.
lubrication drop that you have to continue for 3 to 6 months also.
Okay.
Even in the lifestyle, you can use the lubrication drop because of nowadays, the computer, mobile, AC, everything. Okay,
Okay.
so you have to continue. But initially, 2 to 3 months, you will require more lubrication drops.
अच्छा.
Okay. So here we done.
Okay. So it was nice getting information from you,
Thank you.
and we are done with the late. So I'm now going for my surgery. Let's come and see. बेटा ये थोड़ा सा देखने के ध्यान है इधर ये लेफ्ट को
जरा भी left को।
Relax, relax. Not जी यहाँ से आइए. Come on, यहाँ स्कूल आपके यहाँ पे आ जाइए, यहाँ पे आ जाइए. हम काफी से नेक्स्ट पर्सन. बैठ जाइए. चंद्रिका का फेस अंदर आने वाला है. आप डायरेक्टली फेस पे भी शूट कर सकते हो, यहाँ पे स्क्रीन पे भी शूट कर सकते हो. Whatever you want.
Okay, doctor.
चंद्रिका. और सेट दिया.
Yeah.
Let's see.
No, not at all.
Okay, I'm meeting your mom here. She's more mother than you are more person. Yes, don't mind.
I am not at all worried. Completely relaxed.
Single operation, complete. Don't fight against it, it doesn't hurt.
Okay.
Relax. Look afterwards will be done. Relax. Look down at your feet. Excellent. Look in the red light. Good. It's so good. They should be a little blurry. आप यहाँ पे भी शूट कर सकते हो. Okay? ऊपर जाना अच्छा रहेगा. जहाँ पे भी आप कंफर्टेबल हो. ऊपर नीचे दोनों करते रहिए. लाइट्स थोड़े से कम हो गए बेटा, 1 सेकंड के लिए मैं बढ़ा दूंगा. Are you comfortable बच्चा? Good. चलो. Now we going to put some sunlight on your eyes. Just see this way. You're going to go outside the application. So it will be a kind of solution like that. Once it goes back, and luckily now it's very fast, and then it goes again. What you get better now, you just do the staff will explain all the medication to you. Dr. Krishna is there if you have any query. Okay, if you want to wait for me, you can wait for, if you want to wait for 20 minutes, so take care of 20 minutes.
क्या बोल रहे हो?
बट काफ़ी मज़ेदार रहा, मुझे बहुत मज़ा आया।
आप 7 डे में अकेला
हाँ
7 डे में अकेला आ सकते, इतना रीजन हो जाएगा।
अभी भी अकेले रह सकती हूँ, कोई प्रॉब्लम नहीं है।
नहीं अभी कैसा है थोड़ा
हाँ
जैसे अभी अराउंड 5 में और अच्छा है अकेला रहना। मैंने आपको बहुत जरूरत है उसकी। ये वैसे हो जाएगा, वैसे रीजन आपको क्लियर हो जाएगी।
यस
सो इट्स अ मैजिक ड्रॉप। ओके और चश्मा बताओ।
So after the drops, you need to take care of your eyes. इसलिए मैंने काला चश्मा जजतावे मेरे मुखड़े पे black. So yeah, it was really nice experience, and
This is after 7 days.
we'll meet after 7 days for the checkup कि कितना improvement हुआ है और कितना नहीं. It feels great. थोड़ा सा blurry vision है and you need to take care of it. So you have seen the procedure. There's nothing harm. मुझे सच में डर नहीं लगा और लगा ही नहीं कि surgery हो गई. It's so quick, you know. दूसरे surgeries के मुकाबले में this was fantastic. I mean, I've never gone through any one of them. This was my first. So amazing experience. And TLVC, please, because you know, friendly staff, doctors are so cooperative, supportive. They explain you everything. जो भी आपका doubt, they'll clear everything to you. And let's hear अगर कुछ और precautions या फिर before to know information अगर कुछ छूट गया है, we'll talk to doctor and let's know ahead further अगर कुछ करना ही है नहीं. For a meanwhile, we'll stop here. I got my laser done. So as per the doctor's challenge, let's see कि बाद में specs पहन के कैसा दिखता है. Before I used to wear and I used to see clearly. Now let me wear and see if I can see that clear, which was previously. No, I can see more blur. This is better. Magic actually. You know, if you wear the specs, I mean, अगर कोई दूसरे साइड से इसको पहनता था and they used to say, यार नंबर है इसमें, the same feeling, you know, I've got to zero back again. I'm so happy. Thank you so much, doctor. This is magic. Really, this is magic. I would recommend everyone who is fearing for LASIK, go for it. अब तक तो painful नहीं है, but let's see. I'll keep you updating how it goes, how are the after effects. But अब तक painless, कुछ feeling नहीं है. Everything is good. Only when you feel little blurred, there are some drops that you need to put in, and it's magic. You can see clearly after that. Thanks. So hello friends, this is my 7th day. I'm going for the checkup, LASIK surgery के लिए. So let's see how are my eyesight now. Catch you there. Guys, here I have reached TLVC again after 7 days. अब देखते हैं. So here I am, the laser vision center. अंदर जाके देखते हैं what's the next procedure. अभी मेरा vision is clear. I can see much better without the specs. But there is a bandage lens in my eyes, so I need to remove them. बस वही करवाने आई हूँ. See you in minutes.
But avoid rubbing and avoid splashing water directly.
मतलब आपको पानी नहीं डालो.
पानी डाल. Very good. ये वो लाइन है जो
मैं पढ़ने वाली थी.
हाँ, correct. Okay.
Yeah.
So मैंने कहा था ना you are going to read around 80-90%. ये 6/9 है. इसके
Wow.
आगे चलते हैं.
ठीक है.
Try this. ये वो लाइन है जो आपके चश्मे से आप देखते थे. बताओ.
इतना क्लियर नहीं है.
यहाँ पे फ्लक्चुएशन शुरू हो जाएगा. आगे जैसे आप ब्लिंक करोगे ना वैसे क्लियर होगा. जैसे ड्रॉ करूंगा ईच एंड एवरीथिंग गिव यू क्लियर विजन. वेरी गुड. आगे ओके. ये 6/9. अब यहाँ आगे चलते हैं. कोशिश करो क्योंकि मुझे पता है ये इतना क्लियर नहीं रहने वाला. कोशिश करो. आज ये 7वां दिन है. बाद में इतना जरूरत नहीं पड़ेगा. इतना मैं ड्रॉ कर रहा हूँ. तुरंत आएगा. तुरंत आएगा. परफेक्ट. उसके आगे चलते चलते कोशिश करो. चलो ये ट्राई करो. 6/5 मोर देन 6. बोलो ट्राई. रॉन्ग को मैं बोलूंगा रॉन्ग है. ओके. बोलो ये क्या है. पढ़ लो. मैं हाँ ना बाद में बोलूंगा. जो दिख रहा पढ़ो. गेस करके पढ़ो. चलेगा.
गैस भी पूरा ब्लर दिख रहा है.
ठीक है. मैं put it wrong. Let me put it wrong. Try this.
ECTAR
Stand and see. क्या पढ़ा आपने? ये 6/5 है. More than 6. Okay.